Today we will talk about early signs of cerebral palsy and why early identification is crucial. CP affects movement, muscle tone, and posture, and identifying it early means children can receive therapeutic intervention and screening for associated conditions. Diagnosing CP in infants younger than 6 months can be challenging due to limited voluntary movements, making mild motor delays harder to identify. Initial evaluation for suspected CP includes a comprehensive history of child focusing on potential risk factors, family history, and developmental milestones. One of the first signs parents notice is often a delay in their child's motor milestones, like rolling over, sitting up, or crawling. Now, if a child is born prematurely, keep in mind that milestone tracking might be adjusted to reflect their early arrival. But if there is a noticeable gap between motor milestones and cognitive development, that could signal a potential concern. Certain developmental deviations may indicate CP, for example, early hand preference before the typical age, like reaching consistently with one hand. It can be a subtle indicator of hemiparesis. Early head control, rolling, or rigid standing may indicate increased tone or exaggerated primitive reflexes. Unusual mobility patterns, example bunny hopping, crawling with one leg dragged behind, can also be signs of CP. After the history, a thorough physical and neurologic exam is crucial, especially examining tone and developmental reflexes in infants, deep tendon reflexes, plantar responses, and clonus in older children. Tone is assessed by moving the infant's joint and observing resistance and positioning. Severe hypotonia may present as frog-leg position with limbs relaxed at the sides. Persistent fisting or scissoring may indicate increased tone. Prolonged hypotonia or fluctuating tone often indicates dyskinetic CP. CP may also be indicated by delays in the disappearance of primitive reflexes. Example, Moro reflex, palmar grasp reflex, and asymmetric tonic neck reflex. Neuroimaging aids in identifying the cause and timing of cerebral palsy injury. The American Academy of Neurology and the Child's Neurology Society have developed guidelines to help healthcare providers use neuroimaging effectively when assessing children and neonates suspected of having cerebral palsy. These guidelines outline the type of neuroimaging tests recommended, such as cranial ultrasound, CT scans, and MRI, and specify when and how they should be used based on the age and condition of the infant or child. CP can often present with hypotonia and other neurological signs, but because CP is non-progressive, it is essential to consider other diagnoses when symptoms suggest otherwise. Common causes of hypotonia include central nervous system disorders like brain malformation, genetic mutation affecting the brain, or injuries during the birth. Neuromuscular disorders such as spinal muscular atrophy or congenital myopathies directly affect muscle tone and reflexes. Genetic disorders include Down syndrome, Prader-Willi syndrome, and Angelman syndrome. Metabolic disorders like mitochondrial disorders can present with hypotonia. Neuromuscular conditions usually show specific signs that help distinguish them from CP. Reduced deep tendon reflexes, weak or absent infantile reflexes, and positive family history. Genetic disorders affecting muscle tone and development often include dysmorphic features and characteristic developmental patterns. Metabolic disorders are sometimes mistaken for CP due to hypotonia and neurological symptoms, but certain features make them distinct. Signs like metabolic acidosis, hypoglycemia, and multi-organ involvement may distinguish these disorders from CP, particularly if symptoms worsens over time. When symptoms such as progression or regression are observed, CP may not be the correct diagnosis. For example, if a child loses previously acquired skills, it might indicate a neurodegenerative or metabolic disorder rather than CP.